Today, we are discussing an important treatment option for the management of stress urinary incontinence in men, particularly after prostate cancer treatment, such as radiation or complete removal of the prostate, called radical prostatectomy. These procedures are typically performed for what is called clinically localized prostate cancer. Men who develop significant, persistent urinary incontinence, which interferes with their quality of life, may opt to undergo implant of the artificial urinary sphincter, which I was explaining at the beginning of this segment. To review, the artificial urinary sphincter contains three major components: the pump, which allows release of urine from the urinary bladder; the cuff, which occludes the urethra and prevents involuntary escape of urine from the urethra; and the balloon, which is actually a pressure regulating balloon, which allows the cuff to remain pressurized during the filling stage. So there is an active maneuver, a voluntary maneuver that the patient needs to perform by pressing on the pump, allowing release of the urine. The patient will continue to have normal bladder sensation and normal sensation for desired void. The success rate of the artificial urinary sphincter is approximately 92%, and it is considered the most successful treatment for sphincteric incontinence in male patients. This device has been around since 1972 after several modifications. The last major modifications were made in the early 1980s, and the device has not had any significant modification since the early 1980s. Thousands of individuals throughout the world have benefited from the effect of the artificial urinary sphincter as a solution for sphincteric incontinence. The procedure is fully covered by Medicare and most third-party payers, insurance, and in addition, it can be performed as an outpatient. The procedure typically lasts 1 hour, and the patient will go home the same day with very minimal pain. After implant of the artificial urinary sphincter, it remains deactivated because there will be some expected postoperative swelling of the scrotum after the surgery. However, in approximately 6 weeks, the artificial urinary sphincter should be ready to be activated in the office. It takes approximately 5 minutes without another procedure to activate the artificial urinary sphincter, and that same day, once the artificial sphincter is activated, the patient becomes immediately continent. Numerous patients throughout the world, including the United States, have benefited from the saving effect of the artificial urinary sphincter. This device has changed many lives. Unfortunately, many patients are unaware of the existence of the artificial urinary sphincter and are suffering in silence. Others are afraid to undergo the operation, thinking it is a significant operation, whereas in reality, many patients will testify that this operation is not painful and is likely to change their life for the better. It's important to note that many men who have severe urinary incontinence will unlikely engage in sexual activity, and therefore the urinary incontinence itself is affecting their level of intimacy with their partner, with their wife, with their family, with their friends, and there is no reason to suffer in silence, to suffer alone, when such a helpful and effective treatment is available, particularly with a treatment which has minimal complications. The complications of the artificial urinary sphincter include possibility of infection, need for revision of the device, and mechanical failures. It's important to note that this mechanical device, after implantation, can be fully explanted when necessary. Therefore, implantation of the artificial urinary sphincter is a completely reversible procedure. So if you know of anybody who's suffering from urinary incontinence after prostate cancer treatment, please inform them of the possibility of this life-saving management option for urinary incontinence in men. It's been a pleasure describing to you the gold standard treatment for management of post-prostate cancer treatment, sphincteric deficiency urinary incontinence in men. My name is Dr. Angelo Gousse. I'm a urologist specializing in urinary reconstruction and particularly urinary incontinence in men and women. It's been a pleasure being with you.